Hi everyone and welcome to my channel Obey the BB. This video of mine is about kidney stones, which are also called renal calculi, nephrolithiasis or urolithiasis. These are hard deposits made of minerals and salts that form inside your kidneys. Earlier I posted a short video about kidney stones. I hope you have already seen that video, and today I am going to discuss kidney stones in detail. Well, diet, excess body weight, some medical conditions, and certain supplements and medications are among the many causes of kidney stones. Kidney stones can affect any part of your urinary tract, from your kidneys to your bladder. Often stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful, but the stones usually cause no permanent damage if they are recognized in a timely fashion. Depending on your situation, you may need nothing more than to take pain medication and drink lots of water to pass a kidney stones. In other instances, for example, if stones become lodged in the urinary tract, are associated with a urinary infection, or cause complications, surgery may be needed. Your doctor may recommend preventive treatment to reduce your risk of recurrent kidney stones if you are at increased risk of developing them again. Now I will discuss the symptoms. A kidney stone usually will not cause symptoms until it moves around within your kidney or passes into your ureters. These are the tubes connecting the kidneys and the bladder. If it becomes lodged in the ureter, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful. At that point, you may experience signs and symptoms such as severe sharp pain in the side and back below the ribs, pain that radiates to the lower abdomen and groin, pain that comes in waves and fluctuates in intensity, pain or burning sensation while urinating. Other signs and symptoms may include pink, red or brown urine, cloudy or foul-smelling urine, a persistent need to urinate, urinating more often than usual, or urinating in small amounts, nausea and vomiting, fever and chills if an infection is present. Pain caused by a kidney stone may change, for instance, shifting to a different location or increasing in intensity as the stones move through your urinary tract. Make an appointment with your doctor if you have any signs and symptoms that worry you. Seek immediate medical attention if you experience pain so severe that you cannot sit still or find a comfortable position, or if the pain is accompanied by nausea and vomiting, or pain accompanied by fever and chills, blood in your urine, or you have difficulty in passing urine. Now I will tell you the causes. Kidney stones often have no definite single cause, although several factors may increase your risk. Kidney stones form when your urine contains more crystal forming substances such as calcium, oxalate and uric acid than the fluid in your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones to form. And now I will tell you the types of kidney stones. Knowing the type of kidney stone you have helps determine its cause and may give clues on how to reduce your risk of getting more kidney stones. If possible, try to save your kidney stone if you pass one so that you can bring it to your doctor for analysis. There are types of kidney stones which include calcium stones. Most kidney stones are calcium stones, usually in the form of calcium oxalate. Oxalate is a substance made daily by your liver or absorbed from your diet. Certain foods and vegetables as well as nuts and chocolate have high oxalate content. Dietary factors, high doses of vitamin D, intestinal bypass surgery, and severe metabolic disorders can increase the concentration of calcium or oxalate in your urine. Calcium stones may also occur in the form of calcium phosphate. This type of stone is more common in metabolic conditions such as renal tubular acidosis. It may also be associated with certain medications used to treat migraines or seizures such as topiramate. Well, I have a video about migraine on this channel. I hope you have already seen that video. That is very informative. If you haven't seen already, you can see that video. The second type is true white stones. True white stones form in response to a urinary tract infection. These stones can grow quickly and become quite large, sometimes with few symptoms or little warning. The third type is uric acid stones. Uric acid stones can form in people who lose too much fluid because of chronic diarrhea or malabsorption, those who eat high protein diet, and those with diabetes or metabolic syndrome. Certain genetic factors also may increase your risk of uric acid stones. The fourth type is rare, that is cystine stones. These stones form in people with a hereditary disorder called cystinuria that causes the kidney to excrete too much of a specific amino acids. And now I will tell you the risk factors. The risk factors that increase your chance of developing kidney stones include family or personal history. If someone in your family has had kidney stones, you are more likely to develop stones too. If you are already had one or more kidney stones, you are at increased risk of developing another. Dehydration. Not drinking enough water each day can increase your risk of kidney stones. People who live in warm, dry climates and those who sweat a lot may be at higher risk than others. Certain diets. Eating a diet that is high in protein, sodium, that is salt, and sugar may increase your risk of some types of kidney stones. This is especially true with a high sodium diet. Too much salt in your diet increases the amount of calcium your kidneys must filter and significantly increases your risk of kidney stones. Obesity. High body mass index, large waist size, and weight gain have been linked to an increased risk of kidney stones. Digestive diseases and surgeries. Gastric bypass surgery, inflammatory bowel disease, or chronic diarrhea can cause changes in the digestive process that affect your absorption of calcium and water, increasing the amounts of stone-forming substances in your urine. Other medical conditions such as renal tubular acidosis, cystinuria, hyperparathyroidism, and repeated urinary tract infections also can increase your risk of kidney stones. Well, on my channel with BB, I have already posted a video about urinary tract infection. You can see that video. That is very informative. Thank you. And another risk factor is certain supplements and medications such as vitamin C, dietary supplements, laxatives. When these are used excessively, calcium-based antacids and certain medications used to treat migraines or depression can increase your risk of kidney stones. Well, regarding migraine, I have already posted a video about migraine on this channel. If you haven't seen that video, you can see that. That is also a very informative video. Now I will tell you about the diagnosis of kidney stones. Well, when the patient comes to us, we take proper history and examination, and if we suspect that you have a kidney stone, you may need some diagnostic tests and procedures such as blood testing. Blood tests may reveal too much calcium or uric acid in blood. Blood test results help monitor the health of your kidneys and may lead your doctor to check for other medical conditions. Urine testing. The 24-hour urine collection test may show that you are excreting too many stone-forming minerals or too few stone-preventing substances. For this test, your doctor may request that you perform 2 urine collections over 2 consecutive days. Imaging. Imaging tests may show kidney stones in your urinary tract. High-speed or dual energy computerized tomography, that is CT, may reveal even very tiny stones. Simple abdominal X-rays are used less frequently because this kind of imaging test can miss small kidney stones. Ultrasound, which is a non-invasive test that is quick and easy to perform, is another imaging option to diagnose kidney stones. Also, we can carry out analysis of past stones. You may be asked to urinate through a strainer to catch stones that you pass. Lab analysis will reveal the makeup of your kidney stones. Your doctor uses this information to determine what is causing your kidney stones and to form a plan to prevent more kidney stones. Now I will tell you the treatment. Treatment for kidney stones varies depending on the type of stone and the cause. Small stones with minimal symptoms. Most small stones won't require invasive treatment. You may be able to pass a small stone by drinking water. Drinking as much as 2 to 3 quarts, that is 1.8 to 3.6 liters a day, will keep your urine dilute and may prevent stones from forming. Unless your doctor tells you otherwise, drink enough food, ideally mostly water, to produce clear or nearly clear urine. Pain relievers. Passing a small stone can cause some discomfort. To relieve mild pain, your doctor may recommend pain relievers such as ibuprofen or naproxen sodium. Medical therapy. Your doctor may give you a medication to help pass your kidney stones. This type of medication, known as an alpha blocker, relaxes the muscle in your ureter, helping you pass the kidney stone more quickly and with less pain. Examples of alpha blocker include tamsulosin, and that comes with the name of Flomax, and the drug combination dutasteroid and tamsulosin, that comes with the name of Gelen. And the treatment for large stones and those that cause symptoms. Kidney stones that are too large to pass on their own or cause bleeding, kidney damage, or ongoing urinary tract infections may require more extensive treatment. Procedures may include using sound waves to break up stones. For certain kidney stones, depending on size and location, your doctor may recommend a procedure called extracorporeal shock wave lithotripsy, and that is ESWL in short form. ESWL uses sound waves to create strong vibrations that are shock waves that break the stones into tiny pieces that can be passed in your urine. The procedure lasts about 45 to 60 minutes and can cause moderate pain, so you may be under sedation or light anesthesia to make you comfortable. ESWL can cause blood in the urine, bruising on the back or abdomen, bleeding around the kidney and other adjacent organs, and discomfort as the stone fragments pass through the urinary tract. Surgery to remove very large stones in the kidney. A procedure called percutaneous nephrolithotomy involves surgically removing a kidney stone using small telescopes and instruments inserted through a small incision in your back. You will receive general anesthesia during the surgery and be in the hospital for 1 to 2 days while you recover. Your doctor may recommend this surgery if ESWL is unsuccessful. And the third procedure is using a scope to remove stones. To remove a smaller stone in your ureter or kidney, your doctor may pass a thin lighted tube, that is ureteroscope, which is equipped with a camera, through your urethra and bladder to your ureter. Once the stone is located, special tools can snare the stone or break it into pieces that will pass in your urine. Your doctor may then place a small tube that is stent in the ureter to relieve swelling and promote healing. You may need general or local anesthesia during this procedure. Parathyroid gland surgery. Some calcium phosphate stones are caused by overactive parathyroid glands, which are located on the four corners of your thyroid gland and just below your Adam's apple. When these glands produce too much parathyroid hormone, and that condition is called hyperparathyroidism. Your calcium levels can become too high and kidney stone may form as a result. Hyperparathyroidism sometimes occurs when a small benign tumor forms in one of your parathyroid glands, or you develop another condition that leads those glands to produce more parathyroid hormone. Removing the growth from the gland stops the formation of kidney stones. Or your doctor may recommend treatment of the condition that is causing your parathyroid gland to overproduce the hormone. Well, if I get a time, I'll make a separate video about hyperparathyroidism and upload on this channel. Okay, now I will tell you about prevention. Prevention of kidney stones may include a combination of lifestyle changes and medications. First, I'll tell you about the lifestyle changes. You may reduce your risk of kidney stones if you drink water throughout the day. For people with a history of kidney stones, doctors usually recommend drinking enough fluids to pass about 2 liters of urine a day. Your doctor may ask that you measure your urine output to make sure that you are drinking enough water. If you live in a hot, dry climate or you exercise frequently, you may need to drink even more water to produce enough urine. If your urine is light and clear, you are likely drinking enough water. And the second preventive lifestyle measure is that you should eat fewer oxalate-rich fluids. Okay, you should control oxalate-rich foods. Okay, if you tend to form calcium oxalate stones, your doctor may recommend restricting foods rich in oxalates. These include rhubarb, beets, okra, spinach, Swiss chard, sweet potatoes, nuts, tea, chocolate, black pepper, and soy products. You should choose a diet low in salt and animal protein. Reduce the amount of salt you eat and choose non-animal protein sources such as legumes. Consider using a salt substitute such as Mrs. Dash. Continue eating calcium-rich foods but use caution with calcium supplements. Calcium in food does not have an effect on your risk of kidney stones. Continue eating calcium-rich foods unless your doctor advises otherwise. Ask your doctor before taking calcium supplements as they have been linked to increased risk of kidney stones. You may reduce the risk by taking supplements with meals. Diets low in calcium can increase kidney stones formation in some people. Ask your doctor for a referral to a dietitian who can help you develop an eating plan that reduces your risk of kidney stones. Now I will tell you about some medication which are used for these types of stones. Medication can control the amount of minerals and salts in the urine and may be helpful for people who form certain kinds of stones. The type of medication your doctor prescribes will depend on the kind of kidney stone you have. Here I give you some example. For calcium stones, to help prevent calcium stones from forming, your doctor may prescribe a thiazide diuretic or a phosphate containing preparation. For uric acid stones, your doctor may prescribe allopurinol and that comes with the name of thioloprin to reduce uric acid levels in your blood and urine, and a medicine to keep your urine alkaline. In some cases, allopurinol and an alkalizing agent may dissolve the uric acid stone. Well, if you have seen my video about gout, I have discussed about this medicine, that is allopurinol, in that video. That video is very informative, so you can watch that gout video also. Okay. Regarding true white stones, to prevent true white stones, your doctor may recommend strategies to keep your urine free of bacteria that cause infection, including drinking fluids to maintain good urine flow and frequent voiding. In rare cases, long-term use of antibiotics in small or intermittent doses may help achieve this goal. For instance, your doctor may recommend an antibiotic before and for a while after surgery to treat your kidney stones. Cystine stones. Along with suggesting a diet lower in salt and protein, your doctor may recommend that you drink more fluids so that you produce a lot more urine. If that alone does not help, your doctor may also prescribe a medication that increases the solubility of cystine in your urine. This was regarding cystine stone. Okay. Well, this was my video about kidney stones. I hope you like this video, and it is a very informative video. If you want me to produce any other medical video regarding any illness for which video is not already there, because I have already uploaded so many videos about different illnesses. So if you want me to discuss about an illness for which video is not already there, you can post a comment, and if I get a time, I'll try to make a video about that illness. Thank you so much for watching this video. See you next video. Bye for now.